It's not easy, but do your level best and at least listen to the instructor what he is telling you. Then after at the end of the day, you might have or gain a lot of knowledge. And that knowledge, when you go back, try to impact that knowledge with your peer groups. So I welcome you all for this training. Now we'll declare the training open. For the hall here, here is the main hall. Then along the corridor, right side where you have the toilet, if you want to use the toilet. Downstairs, we have also 2 toilets there. If you want to use them, you can also go downstairs now. If you need any assistance, call our attention. We are here for you people. So I wish you all the best for a successful course. Thank you.
Thank you, Mr. Fa. We yet to receive our president, who is Jais, but he is on his way coming. Also, the resource person, who is so from National AIDS Secretariat. He will be the resource person who is also on his way coming. Registration also, when he is here, we will do the registration for all the participants who are here. And I believe in the next 10 or 15 minutes, they will also be here. So for now, we can relax and wait on them. Thank you.
On behalf of our German board and the members of the Social Project for the Gambia and Senegal, I want to say welcome. We are very grateful that we are here today, that we follow our invitation. And how it comes that we come to this day today. It was 8th of March this year. I was in Gambia and I heard that some people in the parliament brought in the idea to run this law of FGM. And 8th of March, you know, is International Women's Day. And when you see what is this, equal rights for women and men, get well-being for women, this is the topic of the 8th of March of the International Women's Day, and at this day we start in the parliament this point. I was very shocked. Yeah, but it is like this. But I realized in the meantime, from beginning in March to the end, I think it was June, when we have the decision in the parliament that the law is still there. I saw a lot of activities from the Gambians, especially the ladies. Your mom, Amina, she organized a meeting in Mahmuda. I heard from her, I see the pictures, with 1,000 people come together for 3 hours, I think so, or 4, and they talk about. And what I learned, what we have not right from our system, from the German side, to discuss about the culture, to set the school or not. Every country, every society has a culture. So we have to, society has a culture. So we have to be quiet. It's a point between you, but we said, what can we do? So this, Amina, your mom, brought us to the German sponsor of your charity, and she brought us to you, and we said, okay, what we can do, we can only give you like a bouquet of flowers. Today is such a bouquet, and you pick these flowers what you need. Of course, you wanted that they pick the whole flower. So, but I think for you is important, you pick these flowers what you need for the moment, what is good for you, what feels good for you, and then we will continue. For us, it's one point, because we spend a lot of money for this day today, but we said, if there's one girl child, and she's safe, this money is a big value, we spend it from our heart. So, I do not know what is happening in the society. Culture is changing. The Gambian culture, our culture, before 50 years ago, for example, the wife has to ask the woman, can I go for work or not? The husband must allow it. It's gone. Now our young ladies are much more stronger than before. They're empowered. This is also what we wish. Because we believe in every society, I travel in Asia, I see always the ladies are hard working, but they are always not equal to the men. This is what I see worldwide. I feel also when the ladies, girls are empowered, we have more peace, we have a better development, and we have a better health in this world. Yeah, look at what is going on now. Putin, Trump, Chinese people, and. We have a lot of old people, any color, they want to come backwards to the roots, to the conservative side, not for the success for the future. I say, any lady in this problems in the world, Netanyahu in this side, all are men. I think no woman will start a fight because he after the child. And I think this also we should put inside, we must come forward, but we should not cancel the culture, but maybe here a little bit, here a little bit, here a little bit, we change to come forward. This culture from the past is not culture in the future. I see the ladies, when I ask the ladies, oh, you have extensions here, you have extensions here, you have extensions here, and they said, this is modern. And the next side is religion, the next side is our culture. What I am? Culture, religion, or modern? Yeah? So you mix it. Also you can mix this point that we spoke about and speak about it. Okay, thank you, and I wish you all a very good thing. I'm out. It's not your floor. This is a discussion. Ask you please. Ask questions. Discuss. If you are not, if you can go read this, at the end, you should be enlightened about what is going on, and then you can choose. Okay, it's good for me or not. Thank you.
Thank you, for this wonderful words. I'm glad that we have so many among us. This discussion is going to be very, very interesting, and the resource person is already here. Mr. Show from National is Secretariat. He has had background. During the presentation, you will come across some pictures showing the actual activity of the cutting of the female genital mutilation. And sometimes men will feel shy, or they may feel reluctant to even look at those pictures. And definitely we have to, because that's the time we can know exactly what women are going through. So on that note, once again, I thank you all. Mr. Soul is here. Mr. Soul, you're very welcome. We have already done the first part of the activity, which is the introduction. He is the man behind the training, although today is my first time meeting him. But we all partners in development. We all are the one common goal. So, Mr. Shaw, the floor is yours.
Thank you. Good morning to all of you. Like Madam Farah said, my name is Hamadi Sol. I work for the National League Secretariat. Is it something new to you? National League Secretariat. Have you ever heard of the name National League Secretariat?
Yes.
I am based at the region, in West Coast region, and the HIV coordinator, coordinating the national response to HIV in West Coast region. That is from Synthetic Health Center, that's in Foni to Farato Health Center. That should be in Foni, Congo, I don't know, not or South, I'm not too sure. But that's where my jurisdiction starts. I am a nurse by profession and also a public health officer. I've started working as a nurse for, I don't know, 15 years thereabout, close to 20 years, I don't know. And then I decided to switch lines from curative health to preventive health. Because public health is all about preventing diseases, promoting lives, and prolonging also lives, but through the organized efforts of society, that we use resources from the local people to make sure that their lives are improved. So instead of getting people, waiting for people at the hospital to get sick, we ensure that they are protected from infections, from diseases and infirmity. And looking at the WHO, that's the World Health Organization's definition of health, sometimes when I look at the definition, I feel like nobody is healthy in the Gambia, in fact in the world. Because the definition is such that it has to do with your physical, your mental, your psychological, your social well-being, and not just absence of diseases or infirmity. When I say infirmity, I mean like paralysis and some other conditions. You have to be fit mentally, you have to be fit physically, socially, spiritually, be it Christian or Muslim or atheist. At least you should belong to some form of deity, religion. And not just because you have malaria or HIV or tuberculosis or something like that. So going by the premise, we try our little best to make sure that we help people stay healthy to all means possible. And one of the things that I consider to make someone unhealthy is any activity or any situation or condition that will impact on the livelihood of the person. And I think my topic of discussion today is FGM, not HIV, because I can talk about HIV from now till tomorrow morning. But I am given the opportunity to talk about FGM. It's not a very friendly topic, to be honest, especially in the last 6 months. It's been a lot of outcry from the public because people have different opinions about it. Some say, oh no, it's good to go with it because it is Islamic. Some say, oh no, it's not good to go with it because it is not cultural. Some people say, oh no, it's good to go with it because it's my culture. Right? But I am not talking today about culture, neither am I talking about religion, even though I am Muslim. But I am putting the religion part out of my head because I am given the task to talk about the medical complications. I know that there is nothing in this world that you can talk about without talking about religion, without talking about culture. Because these two things is what saves a human being. You are either Muslim or Christian, you are either Buddhist or atheist, or you are either Mandinka or Kula, or you are either black or white, or you are Hispanic or Asian. Okay? So anything that surrounds you will not be anything outside this space that I've just talked about. But I think Sign Language have made my work very easy. They want me to talk about FGMC and the medical side, like some of the complications that might arise when a girl child is taking circumcision. Like if you expose a girl child to FGM, what are some of the complications that may arise? So that's my role here today. I wish that was a PowerPoint. It would be nice to see some of the pictures so that you appreciate and learn more about what I'm going to talk about. Most often if you go to the radio, to the media, when you start talking about issues of contemporary nature, people give you all sorts of names. Oh, he's been given money. Oh, he is not religious. He's an outcast. But I tell you, I think I allow you to give your books first, then we continue.
Okay, and the president is here. Breakfast also is not. So if you're done with the first part of it, then we can go to the president. We have breakfast and then we come. Then we can go individual introduction.
That's fine. So I'm told that the donor stuff is about. How many donors do we have? How many dollars do we have in the room?
Cholas.
Oh, really? Okay, so they said the Jola stuff is loud. This is just an intro, just to give you an insight of what we're going to discuss about. I promise you it's going to be very interesting. Because the first thing that I did as a person, as a young person who graduated from the School of Nursing, is for my boss to take me to the labor ward for the first time. And when he took me to the labor ward, all that I saw was a woman in pain. And I'm supposed to deliver that woman, like to help the woman give back. The experience I'm going to share with you, and we will talk about some other complications that epilepsy can give. So I think I can stop here before the dollars will start from their faces, and we'll come back after the break, right?
There's no time we are behind that. For anyone who wants to talk, please, you can introduce yourself and your name and where you come from, so that Mr. Sword can be able to talk to each and every one of you.
Breakfast today. We will not, this call is for free. I communicated with the Social Project GBV Senegal. I told them that look, first we are grateful of one thing. Whenever we have such gatherings, it's 100% free. We are not paying any dollars as far as this course is concerned. And that cannot be done without any other people than Joint Operation Center. So under the leadership of Joint Operation Center, we really thank you guys so very much for everything. Give us all this for free. If you go to certain areas, you pay thousands of dollars to get this course. I will ask Mr. Bar, when we have training in our areas, we have to pay thousands of dollars to get their course. But here, this course is 100% free for us to conduct our training successfully as far as it is geared towards the development of the school. So we really thank you so much.
Thank you very much, madam. I am not, maybe I have to make this very clear. I am not a teacher. Okay? I am not a teacher. All that I do is to supervise nurses to do their work properly. I've never stand in front of students to teach, okay? So if I do not do it right, please don't blame me, okay? I think it would be nice to know your names and where you come from, just quickly. I am supposed to go to the Gambia College from here. There is this room convergence and I'm supposed to be a presentation for China. So really I would spend maybe 1 hour 30 minutes and I get there. But we can do this so that I know. Maybe if I meet you next time I can call you by name. I'm not Jola or Sagan. Yes, mother from the
I am Anna Mendes from the Gambia.
Yes. Sadeva.
Yes.
Where is Sadeva?
Nyamba.
Nyamba. Yes, mother.
I am from the Sinangu I am team
I am Abdullah Sadio from Income.
Where about from Kamakuna?
Where is Nyamba?
Kamakuna is full. Kamakuna is
I am Muhammad
Yeah, I'm Sumana Yao.
Yao.
Yeah, from Manila.
Why have you been quiet?
I know.
Kafuda. Yes, sir.
Yes, I am Sama Jao, also from
Also Jao. You are sitting here. Yes, sir.
Let's give a call from Bakoyi.
Yes, sir.
Even from Kaputa.
You come back from Sanya.
Invite to Sanya.
You're finding that with the president. You know about it. I'll be there. So today, like I said in the introduction, we are going to talk about the medical complications or the medical aspects of female genital mutilation. So I want you to listen with your minds and not your heart, okay? So that we are able to delve into the issues. Can we do one thing? Do you have to place the papers down so that we finish the presentation and you do the work later? Is that okay? Yeah, otherwise then you're distracted. Okay? So, yes, like I said in the introduction, my responsibility is going to be on the aspects of FGLC. Like I said initially, it's a very contemporary issue because so many people attach so many concepts to it. Some see it from the religious perspective, some see it from the traditional perspective, some see it from the cultural perspective. But I am seeing it. The eyes that I'm looking at this presentation is going to be in the medical perspective. Okay? And by definition, FGM is a medical terminology, female genital mutilation. Okay? It was coined by a joint body, UNICEF, that is for children, UNFPA, Population Affairs, and World Health Organization in 1997. So this is a very old terminology, definition rather, but it's still valid. It is, whenever you hear about FGM or female genital mutilation, it involves any procedure that involves the partial and total removal of the external genitalia. You will see how the external genitalia of a woman looks like in a pictorial form. Okay? For the ladies here, I would feel a little bit sorry because when I speak, I want to be very practical. Okay? There are some words that I will use that may look a little bit offensive, but it's for learning. It's for us to understand. Because if I'm talking too technical, you will not understand. So if I'm also talking so vague, ambiguous, you will not understand. So I have to call a spade a spade. So please, if I call a spade, don't feel offended, alright? It's for the purpose of learning. Is that okay? Beautiful. So the external genitalia, or any injury to the female genital organs. The female genital organs are many. We will get to them later. Either for cultural or for other reasons, but not on therapeutic grounds. And when we say therapeutic grounds, is treatment. Anything that has to do with treatment, anything that has to do with medical benefits. So in essence, female genital mutilation has no medical benefits at all. Okay? Because some of the times I hear people argue and someone will push me to the corner to say, oh, if the local people are not doing it properly, why not we ask the nurses and the doctors to train the local people? But the baseline is that anything that has to do with the cutting of the female genitalia has no medical benefits at all. So any girl child that is taking circumcision or for cutting, nobody is doing it because it has any medical benefits. Is that okay? Have you ever heard of a condition called fibroid? No. Okay. In fibroid, women will go under surgical procedures. They will go on an operation because in the uterus, where the child should, where fertilization should occur, where fetal development, where the baby should grow, there is something there which is not supposed to be there. So the woman can be taken to an operational theater. The stomach tear open, the uterus open, and they remove those cysts that are there, those unwanted parts that are there. So that is for a therapeutic reason, that is for a medical reason. Okay? There are also sometimes when you have certain, like some part of the body overgrows. If you're very observant in our communities, we can see some people develop an extra growth on their body, on their skin. Some you can find it on their pinnae, like on the earlobe. Some you can even find them on other parts of the body. It's unwanted. Okay? So you can go to the operational theater and have it removed. Sometimes you can even have lumps, something that can grow on the skin. You know, it's a little bit hard, but it's not part of the body. Alright? So those can be considered as therapeutic because you're doing it for medical reasons. But for FGM, any cutting of any part of the girl child or the female genitalia is for no medical reasons. That has to be very clear from the concept. Is that okay? Do we understand? Do we understand? Are we okay? Yes. Beautiful. So the government of the Gambia has been very interested, about the welfare of women and children. In fact, any serious government in the world must be interested in the welfare of women and girls, because almost 98% of the ills of society happens to women. If there is war, it's usually the women and girls and children that suffer most, isn't it? So for a government to be serious, it has to put in place the welfare of children, women and girls in the forefront. So this is why in 2015, after some negotiation, after some row, the government of the Gambia, through the Women's Bureau, passed the Women's Amendment Act in 2015. That was this FGM. So from 2015, the government of the Gambia said no to FGM. If you do it, you are sanctioned by law. Okay? But naturally, human beings don't want to feel cornered. Nobody wants to feel tight. You want to be free to do whatever you feel like doing. But the government has a very important, very valid reason to put a ban on it. I come from a family where somebody among my family is a dancing bar. When I say dancing bar, it's someone who practices MGM. I could remember I was young, very young. Back home, this old woman would come to our home on contract. They would call her to come to the house. And when she is there, a lot of children will come. A lot of girl children, as young as her age, will come to the house. And all that you hear is screaming in the backyard. Okay? I was not happy about it because, from when I was young, I had this feeling of becoming a health worker. I had the feeling of being someone who will help society, who will be an asset to humanity. Okay? So seeing all those things happening, makes me interested to know exactly what's really happening. Right? So I really hated the government then of Germany for coming up with a ban at that time. To say, anybody who practices it openly, or anybody who supports or kind of aids or advertises anything that has to do with FGMC, we're going to face the full force of law. And I think it has contributed immensely in reducing the prevalence of FGMC in the country. Although we understand that human beings can be very dynamic. If close one gate, they open another place. Right? So some people were doing it under the quarters. I remember in URI, I wouldn't mention the particular building, there was this child who was taken for FGM, and the procedure went wrong. Instead of cutting the genitalia, the dancing man, because she's old, and not very strong, mistakenly cut the nerves. And the nerve endings are very sensitive, and there can be a lot of bleeding if you mistakenly cut them. So this part of the vagina is a very sensitive place. It's very rich in nerves. This is why when you touch a woman's genitalia, she will react. She will react because you're touching the nerve cells which are connected to the brain directly. Okay? So this procedure went wrong. The nerves were cut, and there was uncontrolled hemorrhage, uncontrolled bleeding. There was profuse bleeding. They could not do anything about it. But in the Gambia, we have this Muslaha syndrome. I saw some Jolas here who are my child. I also saw some Jawas here, about two of them, who can eat 2 loaves of bread in the morning. So if I'm very angry now, I want to fight somebody, and a Jawa soldier comes to me and says, hey, so could I act? I have no choice but to respect what that Jawa said, and stop what I do. Okay? So that case was buried under the carpet because of the Muslaha. But that woman should have gone to jail for causing damage. Because if there is uncontrolled bleeding, if care is not taken, it can lead to shock. And if nothing is done about it, then the person dies within a few minutes. Okay? Are we okay? Yeah. Like I said, I'm not a teacher. I'm just talking. I hope I'm making sense. Right. So the types of FGMC are 4, but in the Gambia mainly only 2 types. Only 2 types are practiced in the Gambia. But we also have a third type, which is the infibulation. It varies from region to region and also from tribe to tribe. Okay? But the most common ones are type 1, and the type 2. You get to see the statistics. That is what we call the DHS, Demographic Health Survey, that is conducted in the country. Alright? So the Demographic Health Survey looks at various aspects of human life. Okay? So studies have shown that a lot of women, about 73% thereabouts of the women in this country went through some form of FGMs. But there are two types. The type 1, is the excision, that is the cutting of the pelvis with or without removal of all or part of the clitoris. If you look at the woman's genitalia, which we will get to see a picture of, the clitoris is covered by some layer, some very thin layer, very sensitive thin layers. So in some parts they will remove that, and they will also remove the clitoris completely. So you realize that the woman doesn't have clitoris at all, completely. Alright? And the clitoris scientifically has a very important role in a woman's sexual and reproductive health. I'll repeat this again. The clitoris has a very important role in the sexual and reproductive health of a woman. Okay? The clitoris naturally will help in lubrication. Right? The vagina is like a plastic. It's like an elastic. This is why when you get to the labor ward, you're amazed how a full human being, like this baby, is coming out from the hole. Right? It's amazing. It's naked, but also, if you look at it closely, it's elastic. Okay? A lot of things come into play for a woman to deliver vaginally safely, to have a safe vaginal delivery. A lot of things will be determinant factor. And one of them is FGM. Although it has to be very clear, if you go to our society, a lot of our old men will say, hey, I'm pregnant one day, will let you know what I mean? You hear them say, I've delivered all my children, 10, 15, 20 children, I'm not happy, right? In science, everything that we talk about is guided by what we call empirical research. Research is a collection of data based on life experiences. Based on life experiences. For example, I can come here and say, half of the women here drank coffee in the morning before they came here. That's what we call a hypothesis. That's my belief. That half of the women, before they reach in this office, had already drank coffee before they come into the hall. That's a hypothesis. But for me to test whether that is true or not, I have to conduct research. Rather, I have to ask, have you ever taken this? Have you done this? Have you done that? Have you done that? So at the end of the day, I put up that data and then analyze. So maybe out of 10, I can say 5 women in the food, for example, drank coffee before they come here. And that is something that has been given to me by their personal accounts and experiences. Okay? So everything that we're talking about here is based on research. It's guided by facts. It's guided by personal accounts. Is that okay? Alright? So the clitoris there will help in lubrication. It helps in making the woman wet when it comes to sexual pleasure, when it comes to sexual intercourse. Now I take you a little bit back to religion. I don't want to say anything about Islam, but I have to say, in Islam, in the Hadith, I don't know who starts here, but it is recommended that before you sleep with your woman, you have to prepare her psychologically. Yes or no?
Yes.
Except maybe for the Jawas who will just come and drink. Alright? But naturally, before you have sexual intercourse with your wife, you have to prepare her psychologically. And this will involve touching, kissing, caressing, those kind of stuff. Prepare her psychology. And once her psychology is stable, you realize that she will start lubricating. This is why rape is a very, very, very grievous offense. Because in rape, there is non-consensus. Alright? There is non-consensus. The perpetrator will force himself or herself. Now, it's not only men that rape, even women to rape. Yes? Even women to rape. So in rape, the victim is never prepared. Alright? So it's a forceful sex. This is why there is a lot of tearing, there is bruises, and there is also high chances of transmitting HIV and even hepatitis. Okay? But if sex is consensual, the woman will lubricate. There would be messages sent to the pituitary glands in the brain to release hormones that will lubricate the vagina. This is why when you touch the woman, when the woman is circulating and ready for you, if you touch her vagina, you realize that she is wet. That's a good indication that the woman is prepared for you. So our men, our brothers out there, we need to also be a little bit gentle, right? Because women are busy all day from morning till evening. They have a lot of responsibilities. They come at home. At night, you come. Hey, it's a more often again. Just there. Hey, come here. Or you just, as a man, you know what I mean? Some men do it, and it's not fair. There are some women who don't want it to be night. They pray that let daylight don't turn into night, because their husbands or their partners are not romantic. All that they feel in sexual intercourse is pain. We get those kind of complaints at the hospital. Some of the fights that you hear from the homes, husband and wife fighting, hey, he doesn't respect me, he doesn't do this, he doesn't under my clothes. Those are things that you see from the top. The bases are there. These are some of the things. The woman will refuse the husband from having sexual intercourse with her, simply because that she's not prepared. Alright? And most of our women, like we will get to the data, have their clitoris removed. So this is why they resort to things that will lubricate them. They go to the market, they buy pastivalda, some even use saliva from their mouth just to lubricate themselves, so that the man would be able to penetrate them without pain. I'm sorry the discussions are getting a little bit hot, but that's the fact. That's why the way, this is what I do, this is what I see. So I have to talk about it so that we understand and appreciate the dangers. Is that okay? Yes. And the pastivalda that has been inserted is sugary, right? It's sugary. And the vagina has what we call beneficial bacteria. This beneficial bacteria helps in cleaning the cleaning the vagina naturally. They help in cleaning the vagina naturally. So if you put some chemicals, they try to interfere with what we call the natural pH of the vagina. The vagina has a pH, just like how water has. Water is non-acidic and non-alkaline, if you go into our basic general science. Is that okay? So if you put those things in you as a woman, you are inviting what we call pathogens, some diseases. In fact, even the natural bacteria that is supposed to be helpful now becomes poisonous, becomes toxic. So you start feeling discharges, whitish discharges. You will start even seeing, feeling itchy. You start scratching yourself. By the time you know what is happening, you're already bruised. And if you're bruised, now your skin is open, you're inviting more infections. And they will not even be classified as sexually transmitted infections, but they will be classified as urinary tract infections. Because if you look at the woman's genitalia, between the vagina and the anus, there's just one thick band of muscles that separates them. Okay? If you go to the toilet to pass urine, if you go to the urinate, or if you go to pass feces to the toilet, okay? Most of the times we use water, isn't it? And in our backyards, how many of us have standard toilets? Standard toilets. Not much. Not so many people. If you look at our socio-economic conditions in the country, most of the time we have water stored in buckets. Huh? And those buckets, you'll be very surprised that if you take them to the laboratory and do some analysis, you will see a lot of microorganisms in them, a lot of them. Okay? So in the process of cleaning yourself, you can even invite some microorganisms from the fecal content into the vaginal orifice, and thereby causing so many problems. So if you come to the hospital, all that we can give you is specialists. We give you things to insert, some medications to insert, so that it will act inside the vagina and then all the irritation, will disappear. Okay? So another important thing is the battling glands. Once the clitoris is excited, then the battling glands are produced. And this battling glands helps in producing very useful bacteria. Okay? Because naturally, you might the vaginal orifice can come into contact with some pathogens, some disease-causing organisms. So nature has created an environment where the body produces useful bacteria that will counter those disease-causing organisms. Is that clear? If you sit at the outpatient department, now I don't sit there anymore, but most of the time, when a woman is talking to you and she bends down her head to you, she's telling you that I have itching in my body. Alright? And it's so nice when you scratch it, because like I said, the orifice is full of nerves. They are full of nerve endings. It's very sensitive. So if you're scratching it, you enjoy it. So by the time you know what is happening, you start seeing blood stains coming on your back. Alright? I've seen a lot of cases like that, and we try to manage them with some medications and some pessaries to inside. Okay? So these are some of the effects that FGMC can have when you remove the clitoris. And not only the clitoris, some will even go, the type 2 will go as far as the labia minora and the majora. We will see the picture. The labia majora and the majora are the two coverings in a vagina. The inside cover, this is a lighter one, is the minora. And the outer cover that covers the entire vaginal orifice is the majora. So some will go to the extent of cutting that part. And if you cut that part, that's the external genitalia, the external covering. It's just like if a tire gets burst and you want to fix it with thread or with some iron, some of these small irons, they call it filifer. You know filifer, right? Yes, I know the job. When they go to steel, they try to remove the filifer so that they can get into the houses. So the moment you interfere with the majora and the minora, then you are interfering with the elasticity. Not for women. When you go to the labor ward, if they have difficulties in, like if the labor is prolonged, you don't want any damage to happen to the fetus, that is the baby and the child and the mother. We try to fasten labor, like we induce labor. So in the induction of labor, you give medications. So you give, let's say, for example, pitocin. So we give pitocin. Alright? So that pitocin helps in increasing contraction. It provokes the contraction of the uterus. The uterus is where the baby is housed, in a sac. So in that part, when it is time to deliver, if the woman is, the space is too tight for the baby to come out, we have options. We can do what we call episiotomy. We put in the faucet and tear it. Sorry, I'm very bored.
Yeah.
I hope I'm not being too rough. I have to say this so you understand. Yeah? These are facts. So we incise so that we increase the space in which the child is going to come out. So after the incision, when the baby is born, we don't leave the woman open like that. We try to close it. Alright? So in closing that, in closing the woman, we use stitches. Stitches that are absorbable. The body absorbs them. You tell this woman, go home, do not have complete bed rest. Observe what we call complete bed rest. No sexual intercourse with your husband. Don't carry something heavy. After 1 week, the woman comes back with a problem. Either one, the husband forcefully slept with her, yes, or she's the only one in the house, the children are young, nobody to help. She will go to the tap to fetch water, and then there's some problems in where we stitch. So if that happens, you realize that the elasticity of the vaginal orifice is distorted. Okay? It's like a balloon. So once you interfere with the orifice, the elasticity reduces automatically. Some of the women will complain, or they will complain that my husband doesn't enjoy me too much because I am too open. And that being too open is because of an episiotomy procedure going wrong. We tear you, close you up, but the closing at some point is being tampered with in the process. So you realize that now the vaginal elasticity is reduced and the opening is too wide. So the husbands will complain that they go mad, the second woman, and there's a problem in the house. Or they go cheat outside and then bring you HIV. Or they bring you some other sexually transmitted infection. Okay? The third one is the infibulation. The infibulation is, in other words, in local terms, it is called closing. They seal you. After doing, some will do type 1 and do type 3 together. Some will do type 2 and do type 3 together. That is after cutting the clitoris and the labia major. They take blood, thick blood, and kind of close the vaginal orifice, leaving a very small space for menstrual blood and urine. Very uncivilized, very uncool procedures. Because that practice has a lot of long-term complications for the woman. On the day that the woman is born, up to the time that she stops giving birth, she has one problem to the body. And the worst part of it is, if it is time to give this woman a husband, a place where you already closed. If the woman, there are instances where a girl can get pregnant once when she is a virgin. When I say a virgin, is someone who does not ever experience penile penetration. Okay? And somebody asks me, how is this possible? Oh, this woman, even her fingertip does not enter through her, but then she's pregnant. Yes, it happens. Because the spermatozoa cells, what comes out from the man during sexual intercourse, is just like in the rainy season, around August, you know, you hear a lot of frogs making a lot of noise in the backyard. Right? If you go where they are, you see some small insects making movements. Right? They have a head and a tail. Right? I think we want them closing. That's exactly how a sperm cell looks like. If you release in a woman, those cells will all run to the vaginal orifice, to the cervix, so that they can penetrate and get the woman pregnant. Okay? So now, if a girl who is not a virgin, do some foreplay, they call it romance. So in the process of romance, the man or the boy mistakenly releases on the girl. Those sperm cells, they can penetrate. They can swim and penetrate the orifice and go and meet a mature egg, and then there's pregnancy. In that situation, when a girl comes in that man, what do you think is going to happen? If a girl gets pregnant in that condition and comes to the level of what you need, what do you think we can do? Can anybody say? Sorry?
I said one will say what?
You said what? I said when a girl is closed, completely closed,
Yes.
because she's sealed, and then she gets pregnant and comes to the hospital for delivery. What happens?
Can we speak one at a time, please?
Yes, please.
In that process,
Louder, please.
okay, in that process, she will find it difficult to deliver because the vagina is closed and there's only little space to excrete. So she will find it difficult to carry on labor.
Very, very good point. So in that situation, when a girl comes to meet me in the labor ward and she wants to deliver, what do you think is going to happen? What will happen?
There will be a process.
Yes.
One is either you widen it. Second one is either you go the surface.
Thank you very much.
Yeah.
These are the two options. Either you do episiotomy or you perform what we call cesarean section. Okay? And all these two will weigh the benefits and the risks. So if the risk outweighs the benefit, then we go for another option. But in that circumstance, most of the time, we go for cesarean section. Because if you do episiotomy, remember that most of these women, those who go through that kind of situation, are children who are not mature. They are less than 18, some of them are even young. Their reproductive organs are not very, very strong to bring out a child. So in that situation, all that we do is to operate. And we all know, I think this has to be outside camera, Madam Lady, if you can excuse me, we all know how the health situation is in this country. Right? Sometimes you are food, never go pop, so that is gone. Huh? Or sometimes you need some certain things, you don't even have them. Isn't it? So operation is not a good option. It can happen, of course, it saves lives, but it's not a good option. If you go for operation once, very likely that the second one would be a cesarean section. If you go for a cesarean section for the second time, not that the third time is automatically serious. Okay? So infibulation is very bad. And you know, like I was also told that the night before the woman will be taken to her husband, and we do that a lot in Fulas, before a girl child is given to her husband, we do virginity test, virginity test. A woman who is completely sick, and we take the woman to the husband to say, okay, you're here, we want to test you. You know, let me make this clear. A woman who is a virgin, but not closed, not infibulated, just has a hymen. That's what we call a hymen. It's just some fluid, thick fluid that covers. It's like a protection that is created by nature to cover, to protect the vaginal orifice from infections. We call it the hymen. So to break that hymen, it's as simple as riding a bicycle. You know, girls who ride bicycles a lot can even break their hymens. So this is why there are some international right organizations who are even against virginity test. Because a girl can lose their virginity not because they slept with a woman, sorry, with a man. Okay? Some strenuous activities can break the hymen, but not necessarily that the woman or the girl is promiscuous. Okay? So, but now if you infibulate a girl, you completely, because you use blood to cover two muscles together, two muscle parts together, and it's like thick concrete. It's very, very thick. I know some women in the provinces, this woman in the provinces who will boast. She always say, I don't come like she's very proud to say that nobody can do anything to her daughter because her daughter is completely sealed. Okay? But I feel sorry. After when I learned about infibulation, I really felt sorry for the girl. For the simple reason is the girl cannot perform any sexual activity because where the marriage should end is completely closed. So the only space that is provided is for urine and menstrual blood. Okay? So on the night of the marriage, this girl child has to be taken back to the nursing bath. We have the traditional way of de-infibulating. We also have the medical way of de-infibulating. There are some conditions that the woman can go through which will necessitate us to increase. Like episiotomy is one way that you can de-infibulate. Like you try to increase the opening so that the baby can come out. But in the instance where it is traditional, the saddest part is that FGMC is done without observing any form of anesthesia. And when I say anesthesia, how many of you here have never gone to the hospital to have your lacerated body being sutured? Like something tear you on your body and you went to the hospital and the doctor wants to, the doctor recommends that you should be surgery.
I think I've experienced
or you've ever seen it being done. Or how many of you have ever had a scorpion bite? Scorpion? Bundalo? Nobody?
Yeah.
Hey, nobody's a farmer here. You did? Yeah. So a scorpion bite, if a scorpion bites you, of course you can have some traditional ways of handling it. But the medical way is the fastest way that you can take care of a scorpion bite or scorpion sting is by injecting you with what we call lignocaine. Lignocaine is a very strong anesthetic drug. It localizes the body. It kills, it kind of deadens the nerve cells. If you go to the hospital, they will inject you, right? So that injection that they give you is what we call lignocaine. So and in FGM, it's an invasive procedure. Invasive, it's a tearing of the skin. So under normal circumstances, before the skin is teared open, there should be some anesthesia, just like operation. Before a woman is taken to theater, before the woman is taken to theater, and before they open the stomach, they first give anesthesia. They give anesthesia, things that can localize the body. So that if you touch the skin, it's just like you're touching sponge. The woman doesn't feel pain at all. So it is maybe after 10 hours or so, the cough like gas or butter, then the woman will start feeling some pain here and there. But immediately before the operation, the woman does not feel pain at all. And even on the operation bed, the woman doesn't feel pain at all. Because they put in a lot of gases. They try to, the central nervous system, the spinal cord, they try to do what we call a lumbar puncture. And put in a lot of gases that will kind of deaden the nerve cells. But in FGMC, it's not there. They just tell you, oh, you know what, you're going to visit your namesake. You're going, especially summer holidays. They tell you, I'm going to take you to your Toma for holiday. I'm not very good in one of them, but I know they say, I'm going to buy you chocolates. The next day, you find yourself in a strange compound, surrounded by strange people. People who you've never met in your life. Very strong women, very wicked, I call them wicked. With all their, frown faces. And now all that they do is they wrestle you to the ground. Okay? And when they wrestle you to the ground, somebody will hold you on the leg, some will hold you on the neck, some will hold you on the arms. And then this woman comes, who is old, maybe about 60, 50, and she's shaking in the hand. Alright? Takes a razor blade is modern, but takes a knife, who must have been intergenerationally passed from Kumba to Geneva. I hope nobody is Geneva here. Okay, from Geneva to Mariana. Alright? The same knife. And there's what we call sterilization. One needle, one person. Before you use a scissors on somebody, you must make sure that that scissor is taken to the autoclave. That's what we call an autoclave. That will kill any germ cells that is found on that scissors. But the knife is not put in an autoclave. It's not sterilized. All that they will probably do is they'll pour some yetajao nasi on it. They'll pour some spiritual water on it to say, today is my day. Today I'm going to, circumcise 100 children, because they don't want anything to go wrong. When they inherited it from their great-grandparents or from the next generation, they also pass it with some power. It has some magical power. Somebody told me I can circumcise 100 children and the blood from party will not touch someone. I was part of the national team that was encouraging voluntary male circumcision. Male circumcision has a lot of benefits because research has shown that it prevents a lot of penile cancer. Only male, not the female, male. Let it be very clear, only male. It has a lot of benefits for the male. Okay? So that is when somebody was telling me, although we want to encourage male circumcision, but we also want it to be done very carefully because we don't want passing of infection, HIV or hepatitis from one boy to the other. Alright? But on the female side, right, what happens is that there is no sterilization at all. The materials that are used are not sterilized. So and if you use an unsterilized material, you're very likely to pass infection. Even this room that we are in here now, if you collect the air sample and do some analysis, you see that there's a lot of microorganisms here. Because I'm talking at the top of my voice and maybe bringing out some bacteria, only God knows. This is why in tuberculosis, it's strictly airborne. When you cough, there's a lot of bacteria that is being expelled into the air. So if somebody gets into the lungs, it causes you infection. So we are against FGM because there is no observation of sterilization. The materials are not sterilized at all. The other thing is there is no anesthesia. I've just mentioned here. So the blood is the blood goes through pain, and this is why FGMC is considered as a violation against the right of the child. Because there is no consent. They don't give consent to say, okay, I want to do it. Most of the times they are babies, they are young, less than 5 years. Just take them somewhere and wrestle them into the ground. And if you're very observant, if you go to the hospital, the bed in which a patient lies before another patient comes in, everything there is clean. If a woman is giving birth, this is why we have what we call uglies. They clean the hospital beds every time. Before, when a woman delivers, before the next woman comes, we make sure that the bed is clean, properly clean. Because we don't want to pass what we call nosocomial infections Nosocomial infection is infection that is passed from Geneva to far. Okay, although of course we have what we call medical negligence. Some of our nurses and doctors, or even our partners, can be negligent in the process. We've heard about instances where a woman is operated CS and some gauze is left inside the stomach, yeah? You heard about it, right? Yeah, those are medical negligence. These are things that may go wrong. Okay? It's not our intention, it's not the intention of any medical personnel to harm a patient. Let that be very clear. Nobody leaves their home to come to the hospital to say, okay, I'm going to kill 5 children. It doesn't happen like that. But sometimes we are human, we are limited with resources here and there, some stresses here and there, and some problems. I have said a lot of things that you may have seen in front of my presentation. So this is how the external vagina looks like. When a woman lays on a delivery bed, this is what it looks like. Okay? So everything that I was explaining, can be seen in this diagram. Okay? You heard me talk about clitoris a lot. Labia majora, labia minor. You can see here, this is the clitoris. This is the... Yes,
sometimes when this happens, you see some men will try to face the other side. They will not look at the picture. We are not here to expose women. This is the reality. Since you accepted to come and attend the training, please participate and you look at the picture. We are not exposing anybody. I'm a woman. I may rather want to reserve my vagina, but this is the reality. We have to look at the diagram. It's important.
I know it's very important that men are here. We are decision makers at home, right?
Yes.
Before a woman does anything, a woman has to take the naturally, that's what we know. So your coming here is very important so that you can say no. But those who have had exposed, those of our girls and women who had exposed to FGM, well, they have control over that. All that I can say is be sorry. But for those who are not yet to be born, or those that are born today, and they don't have to really say this on the ground. Sure. That anytime that I have a girl child, if anybody is like this girl child, the girl to FGMC, I'm going to put it suicide. Because I know for sure that another girl is going to go through a pure life. And thank God, Allah has blessed me with a great girl. So 2 months ago, she's home, and even if I have her crying in the house, even outside, I don't go and see what is happening. Because my first daughter was taken through FGMC without my consent, without my notice. I didn't even realize it. Because men naturally are not at home, they're always on the streets. My mother, connived some, my people in the home, and they took my girl child to FGMC without my notice. So it is when times go by. My daughter is, I wish this is not on camera. My daughter is complaining now. She's experiencing problems. And I've seen a lot. I've had a lot. So if you hear people criticize nurses and doctors, sometimes I feel very offended. Because we went to the extra mile to save lives. We went into the labor ward with a torchlight to save a woman. A woman who is brought on a horse cart and who has been driven maybe for about 2 or 3 kilometers, who is completely anemic. When I say anemic, it's low blood, who is almost at the point of dying. Sometimes the little $10, $15, $100 that you have in your pocket, you want to remove it. You remove it out to buy medicine for the patient. You buy food. Some of them are very poor. They don't even have anything to eat in the morning. So your presence here is very, very important as well. We should be bold enough to say, you know what, let us protect our grandchildren from going through this pain. Some women will say, oh yeah, I've gone through all this and I've not had any problems. That is true. Like I said, that not everybody that is starting in the labor ward there is starting because of FGM. Naturally, every woman goes through labor pain. But the degree at which we respond to pain differs. But at FGM, it's an enabler. It's like an enabling factor, an enabling environment to solve the complications that may arise. Am I making any sense? And so we should be bold enough to make changes. You know, when I had the National Assembly that was fighting each other about FGM, I said, come on, we have so many other important issues to talk about. How many women go through gender-based violence? How many women are in the name of marriage are in prison in their own homes? They go through emotional trauma every day. You wake up in the morning as a man, you pack your things and go and sit in the counter the whole day. The woman suffers in the home. I went to the shop that day, I was buying bread, food for my family. The woman came there to the shop. She bought 2 pieces of bread. That day I couldn't bear it. I had some tears. 2 pieces of bread. She cut the bread into 4 pieces. She had 2 children. She gave one to the older child, one to the other child. The other one she took it. Then 1 and a half. She told the shopkeeper to put it in a plastic. And she hid it under the rubber. I'm like, yeah, what's wrong? I couldn't understand. And I had to ask her. She looked at me and said, Bariki, then you go off to the swamp, and then you get. And when we go back home with this bread, they're going to have it. I'm like, what do you mean? He said, my husband is going to take this from me and eat it. I don't know, it's my sweat. She told me.
Pull up.
So a lot of things happen in society, all right? So we have to be strong enough as men to protect our women and girls. They are very vulnerable. They're very weak. I know there can be the other side of them, but that's not only them. Even the one Allah have said in there that women are incomplete. They are from the view of the men. If you leave it there, it's bent. If you want to force it, it breaks, isn't it? So we need to be very gentle to women. We be very nice. We have to be very nice to women. We protect them. Otherwise, they are going to give back to children who will be revolted in society. Any unhappy child that you see on the street, know that he's from the unhappy family. Know that that woman that is at the house, that's what he calls a mother, is not happy. A very stable woman can make a very stable home. Take this from me. You know, when we think we are physically fit, we are masculine, we have power. But it is wisdom that takes a home, not power. You know, if you use power, you instill fear in people. When they are in the Hore, Bhavana, everybody will roll their tails and sit very nicely. I've seen a man's daughter who got pregnant. A man's daughter who got pregnant. And that girl was brought to my clinic for abortion. Because need to mamo yadi about another. If the imam knows about it, don't slaughter the girl. That girl is not disciplined. Discipline is not about instilling fear, but it's about instilling wisdom. When you empower a child with positivity, whether you are present or not present, they will do that. If you instill fear in them, they will only act boldly in your presence. But just don't do bad. They're the ones who will enter at night in their houses with their mobile phones and be playing field constantly. You tell them to go to school, they go up to Johnson back and try to go to their boyfriend's house. The next minute, go for all that. She's pregnant. Okay. This is not part of the. I'm just trying to answer Jimbo this question so that we can appreciate the sense, right? Yeah, I'm not just a hardcore. I'm also a counselor. We have this model of people who are vulnerable people in society. They have nobody to go. So that's one of the see the life in the positive thing. So this is what you see when a woman comes to labor work for delivery. So the labium majora is the minor that I was talking about. This external cover is the major, and this small thin line is the minor. Okay, that's the point. This is where the baby comes out, and this is the urethra. This is where the urine and the menstrual blood flows. Okay. Yes, I think I have some other things. You've seen this. These are tools that are being used. Yes. These are tools that are being used during FGM. So these are the tools that are used. Some of them say now they're using razor blades. But razor blades, these are some of the tools that are used in So here, yes, if I adjust it, this is how it works. Get the whiteboard. Oh, the whiteboard, yes.
You are not saying properly.
The water, the spiritual water that is being used on the water. So here this is a typical situation in which the backyard where girls are being cursed looks like. You know, if you go to the hospital, like I said, when a woman is, when something procedure is done, when there is blood or there is vomitus or there is discharges, you make sure that that place is completely clean before another person comes in. But in the situation of FGM, probably the blood here serves as some magical power, like some spiritual power. They want to conserve it, so that maybe after the whole process they can dig a hole and put the whole blood there, or they can probably use it to wash their hands to get some power and stuff like that. Okay? So here, the mixing of blood, the blood coming into contact with blood can spread infection. HIV is evident. Now we're talking about hepatitis. These are situations where someone can contract diseases because their blood has come in contact with another.
This blood is basically not the blood of a child. It's the blood of different girls or women. Okay, so is this the same blood that they will use? Because this is a mixture of different blood. Is this the same blood you use in inflammation?
Very much likely. Very good, this guy is very small. Very much likely that a child that would be infibulated would not have just a pint of blood, but at least some collection of blood to be able to hold two parts of the skin together. So you will see a picture where an infibulated child looks like. When they do the infibulation already, they use some ropes to tie the legs together. So now in this situation here, in order to get enough blood, this is a place where they can tap the blood from and infibulate the child. And once they do that, there are high chances that you're passing infection to the child. Okay, that's a very good. Okay, this is what I was talking about, which is dislocation. Some of the times, like if this child starts crying suddenly, they say, hey, you hear the children, they say, oh, a child will not cry out of nowhere for no reason. They will have reasons why they cry. Maybe 2 weeks after the procedure, the child may have had dislocation. A child may have one of the muscles being torn off. Because, like I said, those three women who came together overpowered the girl, in the process of, because this girl is going through pain. Automatically, 100% pain. Huh? Because there is no what we call localization, there is no anesthesia. Now is the razor blade to the body. Huh? Can you imagine? How do you feel this? Yesterday I said this to someone and before I could do this myself.
This is a hand hold.
Yes.
There's another hand here.
Yes.
Somebody
Before I could even finish my statement, the girl just dropped. I know she had, imagine, how is it possible to take a razor blade and tear somebody's skin like that without any anesthesia? And this is exactly a typical case. Alright? So this woman with the blue bracelet, you can see how she holds the child's leg. And this child is not feeling cornered. The child will also find ways and means to fight back. Because you will try to restrain the child and you're putting pain in her. So obviously she will move. In the hospital, when we are doing any invasive procedure, we make sure that we localize it. We put some anesthesia so that you don't feel the pain. Right? So maybe soon, maybe after 2-3 days, this child will start crying out of nowhere. They will start saying, hey, Jine Jokotoba, and when actually it's because the muscle has been torn, or maybe the bones. The bones of the child are very brittle. This is why during delivery, the head, the skull of the child, has what we call intracranial sutures. Okay? The different bones that are being set together. They are so soft. This is why the midwife can put his or her hand inside the vagina to be able to hold the chin of the child. This is the chin. The obvious bone to be able to help the baby's head come out. So the skull at that time is very soft. So this will continue before the bones will be hardened. It can take more than 5-10 years before the bones will be very strong. This is why many human beings have what we call baby teeth. They call it baby teeth. They will set at some point and then you have the original teeth coming, isn't it? Alright? So the baby's bones are also brittle. So too much of force on it. This is why I am very against the traditional way of massaging. I know in the family way. When she has a grandchild, they will hold the hand and be holding her with one hand this way. You see it happening, right? Yes. Our homes, they say, it's not good. The bones are very brittle. You hold the baby's hand. This way.
This is something that we believe in. So, this is what we have to do.
It is harmful.
Yeah.
It's very harmful. You hold the baby's hand this way. Remember, the baby is 3 point something kg. At birth, the normal baby will have 3.5 and after 1 month, the sugar is 1 or 2 kilograms higher. Now you're holding like a 4 kilograms baby with one hand, and pulling it. So this place has the shoulder blades is connected to the clavicle. This is the clavicle. This hard bone that you see here. This is the shoulder blade. They are connected by a joint here. So if you pull this child to some degree, remember. Almost 3/4 of the body's weight is down. Right? You hold the child with one hand. Automatically, you will cause what we call shoulder dislocation. Okay? So the baby will start crying. Hey, you give her breast milk, she will not even breast. She will not even feel breastfeed because there is pain. Alright? So we can do it transitional, no problem. But we do it gently. I will stop my mother if she wants to do that to my baby. So yeah, okay, that's the configuration here. If they want to make sure that the two skins hold together, some will be done naturally. Some will be done naturally, but some they have to do it so that it can stick together. So they will tie the two limbs, the limbs together, so that the blood can hold. The two skins, two skin tissues can hold together. Okay? So this will be there for about 3 days, 4 days. And then if this is done now, remember it is blood that they use. And during the Tabaski Day, thank God I only eat meat on Tabaski Day because I don't have money to buy meat. I think it only is $500 an hour. How much is a kilo of meat? You see, I don't even know how much a kilo of meat is. Because I cannot afford it. But if you kill a ram on domestic, what do you see after 10 minutes? When you kill a ram, it's called clotting. So here, if the blood accidentally clots on the ureter, where the urine comes through, then it's clotting. This is how the blood passes in. And even if she wants to pass in, she will go through a little bit of slender, she will be afraid to pass urine. Sometimes this child will be taken back again to the nursing bath. But we take it back to the nursing bath to tear up that space so that the child can go through, the child can practice and can pass out urine. And that's another pain, eh? And you know, urine is acidic. Huh? Urine is acidic. Do you know acid? Huh? It's acidic. If it touches wounds, it hurts. Huh? Yeah. So these are some of the things that we think it's not nice enough to. It's not nice enough to put women through this. This is how an inflated vagina looks like. Everything is covered except that small hole that you see there. You can see two holes. Huh? This hole, this is the small space that we have left for menstrual blood and urine. In this situation, do you think a woman can just child can deliver when she is pregnant?
That's not possible.
Unless if you perform Yola magic. Because at the level I see that a lot of them coming with compulsions. With Nassau, right? This, how do you say Nassau in Yola? Safara. They come with Safara. They come with 4 on the head. Then I see them like, come on, let us cannot do anything there. Alright, this is a medical procedure, right? So in this situation, yeah, it's difficult. So it's either this way
Like, you're very funny.
or we do another defibrillation.
Let me change my direction more like.
The likelihood that vaginal orifice will be distorted is very, very high. So for example, this is how we can do it. This is the traditional way of doing it. And this is the medical way. You can see a faucet. Huh? You see a faucet right there, right? But before this faucet is inserted into the vagina, this child, this girl, this lady must have gone through localization. She must have
Are we concentrating, please?
She must have been injected with lignocaine so that the vaginal nerve cells are dead. So you can tear, you can remove, you can cut without any pain.
This kind of thing.
So this is the difference between traditional and medical. See the traditional. You see the finger. So they insert this finger and pull. So this skin has to tear naturally. There's no razor blade here. There's no cutting instrument. So the finger is a machine. It's a cutting instrument here. You see the difference. So this is why women are believed. No, don't worry. He's also helping me. This is why women are made to believe that it's nature to go through pain, and that's not true. Right? Womanhood is not about pain. Okay. So there is one thing too that we see happening in some instances when the procedure goes wrong with all the keloids. In Mandinka they call it Como and no Como, right? Like if you have a very big one. Sorry, let me say this.
Can we have one discussion, please?
My son had this. He was riding a bicycle and he fell off. So the handle of the bicycle hit the chin. So that was a laceration. Naturally, normally when my children are sick, I don't take care of them. It gets very bad, so I send them to another person. So he was sutured. So after months, we started seeing the part that is with suture. We started having some scars. So but the scar now turned to a keloid. Okay? A keloid is an overgrown tissue, cells of the tissue. The cells of the tissue misbehaves, they overgrow. Okay? And you know, when he looks through the mirror, he's not happy. He's not happy with it. So we had to take him to the hospital. And he went through about 3 or 4 months injections. There's an injection that you can insert into the kilos and it will reduce the size gradually. It's fine. Cosmetically, it's really sounds good. So, but now in this situation, if you want to do this to a woman, you are going to expose her to a lot of harm. Because those medications that you are going to inject in these kilos would have an impact on the nervous system. So there can be complications when this procedure is conducted. Okay? And most of the time, these are women who will never get married. They are in society. Any man becomes married. Or they are married to a party, 2 months marriage is destroyed. They go to, they maybe stay for 2, 3, 4, 5 years, and somebody comes and marries them. Okay? So this is why we must not judge. Something that you don't have an idea about, please don't judge. Yes, please.
Before you proceed, I would like to understand something. Defibrillation, when it is done traditionally, the pain, like can that lead to the instant death at that point in time? Or will the pain after the defibrillation done, will that lead to trauma that will cause death?
Yes, one thing that I know for sure is that women who go through complications during pregnancy, for example, this child now, if the procedure goes wrong, these are women that will live to hate men for the rest of their life. These are women who sees marriage as a punishment center. You see them now in the center. They can only talk to health work. Before they open up, it takes time. But if they open up, maybe 1 or 2 sentences, the next sentence they start crying, they break down. So you can spend a whole day with them, and they become part of your family and friend. So there are some form of trauma that you expose your child to. They become unhappy for the rest of their lives. And traditionally we call them, hey, Jinamola, hey, Girabla am, hey, Girila am. But actually, it is the effects of the trauma that she had been exposed to the child that makes her continuously become violent and uncooperative women. Okay? So this is one of the reasons why FGMC is supposed to be discouraged as much as possible. And don't tell me all the hospital nurses or doctors should train our traditional people, because we believe there is no, not even believe, there is no medical benefit at all, zero. So we don't do any training for any traditional medicine. Okay? So here, the picture is not very clear, but this is how a woman in labor looks like. That dark thing that we see in the center is the head of the baby. So if the vaginal, the vaginal part is the outside is normal, the sleeve is normal, it's very easy for this child's head to come out. The most difficult part of labor is just the head. Once the head comes out, the rest, remember the child is swimming in what we call an amniotic fluid. The fluid is very slippery. Okay? That is why the woman that the child, when you do an X-ray, so scanning, abdominal USS, ultrasound, you see the woman, so the child swimming like a frog, small frog. Yeah, so once the head is out, the rest is just hold and pull, and everything comes out. Then you have you clip the cord, that's the umbilical cord, and then you cut it out. Then you now deliver the placenta. Okay? So we can continue this on and on and on. This is a typical, okay, now let me show you. This is a normal vagina. Okay? But this is an abnormal. Now this is what we call crowning. The baby's head is only visible by the doctor, by the midwife. And this child, at this stage here, this child, you can see the vagina is even swollen. You can see it swollen. So all that swollen thing that we see there is the head of the baby. And this is what causes what we call fistula. We have 2 types of fistula. The RVF, that's the retrovaginal fistula, and the VVF, vestibulovaginal fistula. Both of them have debilitating impact on the woman. If care is not taken, if this woman is probably a teenager who got pregnant out of wedlock, you know that shame, that shame of a girl child being pregnant outside marriage. So most of the times they don't come to our facilities on time because of how society views them to be, right? So if this girl keeps hiding, up to the last moment, now it is time for her to come to labor and comes to being with this. And sometimes in the labor world, especially places like Brikama, Jambe Farmers, when you have 3, 4, 5 women in the cubicles delivering at the same time, like maybe 2 nurses will be running there and running there. At the same time, 4 women delivering at the same time. You are delivering the placenta here, you are cutting the cord there, you are doing vaginal examination here, you are sterilizing this other one here, you are fixing the cannula for this one, maybe 2 or 3 nurses, versus 4 or 5 patients. In this situation here, if you do not act fast, and the only way that you can act fast is by doing what we call vaginal examination, VE. So if you do a vaginal examination, this is why when a woman is taken to the hospital and she is in labor, the first thing that the nurse will do is to put on gloves, right? And that glove, she is going to perform magic. And the magic there is she uses 2 of her fingers inside in the vagina to see the length and the cervix is dilated. Remember, the uterus is covered. I hope my time is over. Okay, this is now becoming a discussion. Let me just finish this part. The uterus is covered. Once there is pregnancy, the cervix is closed. The cervix is a checkpoint. Naturally, the checkpoint is closed. This is why a woman who is pregnant, there is what we call SCG. These are hormones that will help, in the growth of the fetus. So when those hormones are produced, it is now sending a signal to the brain that, okay, my mission is accomplished, I've got what I want, there is already something in me, so the cervix will close. So this is why there cannot be 2 pregnancies at the same time. Pregnancy can happen only once. Once you are pregnant, you only have to go to 9 months. Even if there are 1 million milliliters of sperm increased inside you, you cannot get pregnant again whilst there's another fetus growing. So the cervix will close. So if you're at labor now, that checkpoint that was closed is now going to open gradually. It opens in centimeters. So when we insert our fingers, then we try to know the time. You hear them say, hey, I'm going to about my the time is not up here, eh? It's not magic, it's science. You try to measure and give it some centimeters and time. Every centimeter is equivalent to time. So those approximately should deliver at 5 o'clock in the morning. Alright? So here, if the cervix is dilated and you, the health worker, do not respond quickly, this baby's head is going to burst this vagina into pieces. And if it bursts this vagina into pieces, there are high chances. Remember the first picture that you saw, between the orifice and the anus there is some band of muscles. But this head, because it is time for it to come out, there is distress for the baby. The baby is in a hurry to come out. Right? So if you're not very responsive as a health worker, this place will tear into pieces. And then you leave this woman with a permanent disability. Thank God in Gambia we have the SOS reported that is managing these cases, fistula cases. Okay? So the woman will now have what we call fecal and urine incontinence. The woman cannot handle feces and cannot also handle urine. Anytime that she has the urge to pass urine, it will just come automatically. Okay? Because the sphincter, the anal sphincter is completely destroyed. Huh? So there is going to be feces and urine. I think I can stop here now. In conclusion, FGMC is mainly carried out by untraditional trained women, and we cannot justify the medicalization, like I said. We need to be trained and give the skills to handle victims of FGM. Sometimes my people can be a little bit naughty. Some things that you see, you're not too very nice. You try to blame the